I'm Anders Carlson, and this is my patient Hannah Boyer, and we're just going to go ahead and do a quick postural assessment. So I'm going to go ahead and look from the frontal view here, and then from the side view, and then posterior view. And we'll just get the other side real quick. Alright, now we're going to assess general thoracic active range of motion. So could I have you go ahead and cross your arms across your shoulders for me? Okay, perfect. Now what I want you to do is I want you to tuck your chin in and then roll your back nice and slowly. Okay, any pain with that?
No.
Just some overpressure here. Okay, any pain there?
No.
Okay, so now could I have you bring your elbows like straight up for me? Perfect. Is that as far as you can go?
Yeah.
Any pain with that? Any pain there?
No.
Okay. Now what I want you to do is, can you try and rotate your upper trunk to one side for me? Any pain with that? Okay. Any pain there?
No.
Okay, and then the opposite side? Any pain there?
No.
Any pain?
No.
Okay, perfect. Now can I have you bring one shoulder down to the side for me? Any pain there?
No.
Any pain?
No.
Okay, and then the opposite side? Any pain there?
No.
Any pain?
No.
Perfect. Okay, now we're going to assess upper thoracic active range of motion. So what I'm going to do is I'm going to palpate C7. Okay, could you go ahead and bring your head back for me? Okay, and back to neutral. Perfect. Okay, so C7. I'm going to count down to T3. Now what I want you to do is, can you just tuck your chin to your chest for me? Okay, good. And back up. Okay, and then could you rotate your head to the left? As far as you can go? Okay, and then back to neutral, and to the right. Okay, perfect. And back to neutral. Okay. Okay, now we're going to assess passive range of motion for the upper thoracic spine. So what I'm going to do is palpate for the intervertebral space between C7 and T1. Okay, and I just want you to go ahead and relax, and I'm going to bring your head into flexion. Okay, now we're going to go to the side. Just go ahead and relax. Rotation. We're going to go down to the next segment. So for T1, T2. And flexion. Move down to T2 to T3. Rotation. Lastly, T3, T4. now we're going to assess first rib active range of motion with inspiration and expiration. So I'm just going to come in here and palpate your first rib. Okay, and then could you just take a few deep breaths for me? One more. Okay, perfect. Okay, now we're going to assess pump handle breathing. So I'm going to come in here and just palpate for the upper ribs. Okay, and could you go ahead and take a deep breath for me? Okay, and then one more time. One more time. Okay, perfect. Okay, now we're gonna assess bucket handle breathing. So I'm just gonna put my hands on your ribs here. Okay, can you take a few deep breaths for me? Okay, perfect. Okay, now we're gonna assess the passive mobility of the first rib using the spring test. So go ahead and just relax for me. I'm gonna just place my hands right here. Okay, perfect. Okay, now we're going to assess the passive mobility of the thoracic spine using the posterior anterior spring test. We'll come here. Okay, and just go ahead and relax for me. Perfect.